Psychosis is a serious mental illness that can be caused by a myriad of things, such as substance use, childbirth, stress, sleep deprivation, or for many people, mental illnesses like schizophrenia, schizoaffective disorder, bipolar with psychotic features, and major depression with psychotic features. Psychosis has historically been a mystery to treat, and it wasn't until the 1950s when neuroleptics or antipsychotics came onto the scene to treat psychosis. Until then, there were rather inhumane treatments like insulin coma therapy and lobotomy and electroconvulsive therapy that were ineffective and largely harmful. The introduction of antipsychotic medication was a game changer for psychosis patients and was the first time that people were able to really recover and have a quality of life again. However, these medications do come with risks, and there are a number of side effects that make people a little wary of taking such medications. Today, I want to talk to you all about antipsychotic medication, who can prescribe it, what it does, what the side effects are, all of the many different kinds. But before I get into that, I just want to throw out a little disclaimer to say that I am not a healthcare professional. I am in no way qualified to offer medical advice or really any kind of advice at all. Who I am is a person with lived experience with psychosis and other mental illnesses who has recovered and can impart the wisdom I've gleaned from many years of hard work in recovery and experience. Also, this is just a quick trigger warning to say that psychosis is a sensitive subject. It is often distressful to talk about or to hear about. So if at any point I talk about anything that may be triggering to you, you are more than welcome to leave the video. Now, let's talk all about antipsychotics. Antipsychotics, or neuroleptics, are a class of medication used to treat psychosis-related conditions and symptoms, such as schizophrenia, schizoaffective disorder, bipolar disorder, major depressive disorder, delusional disorder, borderline personality disorder, severe agitation related to autism spectrum disorder, delirium, dementia, and psychosis caused by other causes. There are two kinds of antipsychotics. There are first-generation antipsychotics, which came out in the 1950s, and then there are second-generation psychotics, which came out after the 1970s, and they have some major differences, but they ultimately do the same thing. They block the receptors in the dopamine pathways of the brain, which ultimately reduces the flow of messages between brain cells, because psychosis is caused by a dopamine imbalance in the brain, and this kind of levels that out and lessens the psychotic symptoms. While first-generation antipsychotics were proven to be effective, second-generation antipsychotics came about to improve the side effects, because the first-generation antipsychotics tended to have more side effects related to Parkinsonism-like symptoms, like tremors. And the second generation, while improving that, did have their own set of side effects related to diabetes and weight gain. Now, that is a broad oversimplification of first and second generation antipsychotics. There's obviously a lot more to them than just the brief bit of what I've said. However, for the sake of keeping this video moving along, I just want to wrap up that section and go into these side effects. The side effects that can be found from both first and second generation antipsychotics. Antipsychotics are pretty well known for having horrible side effects, and I know for me personally, this is the only kind of medication I've been on that I've had side effects from. Although I would say when I was taking amphetamines for narcolepsy, I did have issues with weight loss, but it was nothing in comparison to the weight gain that I had with antipsychotics, and that tends to be the most disliked, I would say. I mean, there are way worse side effects, but the weight gain is across the board the most universal one that I hear people talk about. The weight gain that you get from antipsychotics is like none other. Antipsychotics affect a lot of symptoms of your body, and the different side effects you can have can be related to your heart, to your nervous system. They can be related to your metabolism. There's so many different ways that antipsychotics play in your health. For instance, just with movement disorders, you have akathisia, where you are restless and unable to stop moving. You're constantly agitated. And there's also tardive dyskinesia, in which you have uncontrollable tics, I would say. I don't know if they're like known as tics, but when I had it, it was like involuntary muscle movements, like my hands and feet constantly moving, wiggling, my mouth constantly moving, just uncontrollably. Another movement disorder that may come as a side effect of antipsychotics is Parkinsonism-like symptoms, which would probably be along the lines of tremors. Some people do develop Parkinson's actually, and that is a long-term challenge for a lot of people in taking antipsychotics over the span of their life. Antipsychotics may also affect your heart. They may alter your heart rhythm or cause orthostatic hypotension, which would be a drop in blood pressure upon sitting up quickly or standing that may result in falling or fainting. They may also affect your metabolism. They may cause high blood pressure or high blood sugar, or even increase the likelihood of developing type 2 diabetes. They're also known for the zombie-like effect that they have on a person because they're very sedating. So not only are you heavily sedated and feeling lethargic and numb, oftentimes you may also have dizziness, you may have shakiness, you may have agitation. They may also increase a person's prolactin levels, and in women or people assigned female at birth, this could look like missing periods, or it could look like lactation actually without breastfeeding. And for men or people assigned male at birth, this could be sexual dysfunction or even infertility. There's also jaundice, dry mouth, constipation, urinary retention, granulocytosis, which is the weakening of the immune system, and neuroleptic malignant syndrome, which is a life-threatening condition that must be treated immediately. It causes a high fever and muscle stiffness and can ultimately lead to death. So wow, that packs a punch. That's a lot of side effects, and they can range anywhere from being minor to severe. Some of them may last lifelong. For instance, tardive dyskinesia is one that you may develop from antipsychotics and continue to have even without that medication. Now, I fortunately was able to dodge that bullet because I developed tardive dyskinesia and got off of the medication soon enough that I was ultimately able to recover. But I know people who've had tardive dyskinesia for decades that actually have to take more medication to treat just that side effect. Sounds like a lot, right? A lot of people would probably be deterred from taking antipsychotics for just the side effects alone. But there are some important things to note in the event that you might want to go off of your antipsychotic medication. Going off of antipsychotics is tricky and it can be very dangerous. There can be awful withdrawal symptoms as a result of going off of medication too quickly. If you want to effectively come off of antipsychotic medication, it is best to do so with the advisement of a doctor who is looking over your course of treatment, who is helping you off of this medication on a slow schedule, because if you were to go off of medication quickly, you could not only develop symptoms like side effects after you've gone off of them. The tardive dyskinesia and the neuroleptic malignant syndrome, for instance, can happen after you've stopped taking them. You may also go back into psychosis. You are more likely to relapse into a psychotic episode going off of medication quickly than tapering off slowly. So don't go off of antipsychotics cold turkey. It is very dangerous to do so. And the kind of withdrawal symptoms you may have are awful. A lot of them are similar to the flu, like having aching, sore muscles, diarrhea, nausea, vomiting, feeling too hot or too cold, feeling restless, having a runny nose, agitation, irritability, shaking, insomnia, sweating, anxiety, dizziness, vertigo, headaches, loss of appetite, mood disturbances, and feeling withdrawn socially. Not to mention a relapse of psychotic symptoms. Now, it is not certain that the psychotic symptoms will come back after coming off of antipsychotic medication, but it is absolutely more likely that they will come back if you were to go off of medication too quickly. So it's suggested that people take a long time tapering off, and typically the longer you've been medicated with antipsychotics, the longer it should take to safely come off of those medications. This would look like decreasing the daily dose slowly over the course of weeks or even months. And again, the longer a person's been on the medication, the longer it may take to safely taper off. Some variables in what may improve the outcome of a person coming off of antipsychotics would be being in talk therapy, having found solutions and coping to manage these symptoms, having support, or being a part of a community. But if you're not even there yet, if you haven't even gotten onto the antipsychotics, how would you go about doing that to begin with? Well, there are a number of people who can prescribe antipsychotic medication, and we will look at 3 of them. First are psychiatrists. Psychiatrists are medical doctors who can diagnose mental health conditions, prescribe medication, and offer therapy. They must have a doctor of medicine or osteopathic medicine degree and complete residency in psychiatry. Next are physician assistants. Physician assistants are mid-level healthcare providers that can carry out many of the same tasks as psychiatrists, such as diagnosing mental illness, developing treatment plans, and prescribing medication. They must have a bachelor's degree in a relevant field and at least 1,000 hours of first-hand experience. Then graduate from a physician assistant program and pass the Physician Assistant National Certifying Exam. Finally, psychiatric nurse practitioners or psych nurses. Psych nurses provide assessments, they can diagnose, they can provide therapy, and in some places they may prescribe and monitor medication. They must have a doctoral or master's degree in nursing with an emphasis on psychiatry. Now, some therapists may prescribe if they have one of the aforementioned credentials, but mental health counselors and social workers cannot prescribe, and they actually can't even suggest medication. However, they can help in getting referrals for patients who might benefit from medication. For patients who are new to seeing a prescriber, they may meet fairly regularly, whether it be weekly or bi-weekly. Typically, when a person becomes stable on medication and really just needs it to be monitored and managed over time, they may go from weekly and bi-weekly to monthly or bi-monthly to even 3 to 6 months out between appointments. Myself personally, I see my prescriber every 2 to 3 months and I enjoy seeing her, so I actually could go longer without appointments, but it's nice to check in with her just to say hi and, go over labs and whatnot. Another factor in taking antipsychotics is that you often have to keep up with lab work, and you may have to fairly regularly have blood draws to test your levels in the event that you may, be developing diabetes, which is one concern I have with one of the medications I'm on. So there are a lot of things to look for when taking these medications, and taking labs regularly helps. So there you have it. That's all I really have to say about antipsychotic medication for you today. I do want to throw out a recommendation, I guess, of a channel that I really love, which is Lauren Kennedy's channel, Living Well with Schizophrenia. She has been treating her schizoaffective disorder with the ketogenic diet, and I've been really fascinated by all of her progress and her videos chronicling this change in her lifestyle and her health care. I think if you are looking for a more holistic approach to treating psychosis, if medication is not the route for you, she is a great source of information, especially when it comes to treating medication through diet. So if that's something you'd be interested in, I would recommend her channel, Living Well with Schizophrenia, which I will link in the description box below. Anyway, that's all I have for you today. Thank you so much for watching. I truly appreciate it. Today's video was a topic suggested by Catherine McCarty 2307. Thank you so much, Catherine, for the wonderful suggestion. I've really appreciated your recommendations. If any of you would like to offer a suggestion for a topic of a future video, let me know in the comments, or just comment what you thought of this video or anything related to medication in general. As always, please like and subscribe to support my channel. This is a growing channel, and I just recently reached 1,000 subscribers. So in celebration of that, I've started a Patreon page, which you can follow or subscribe to. I will put a link for that in the description as well. And I post every Thursday/Friday. I will maybe post next week. I'm not sure yet. I am actually doing a research conference for Psychosis, and that will be the same day as my upload schedule. So we'll see. There may or may not be a video. It'll be a little loosey-goosey this next week, but I'll definitely be back the week after that with a video for you. That's really all I have to say, so I'll just wrap it up with that. Thanks. Bye.